I'm going to go ahead and introduce Mike Pudlo, our nurse practitioner, who's going to give us a presentation on self-care.
Good morning, everybody. My name is Mike Pudlo, one of the nurse practitioners here at Methodist with the heart failure disease management team. My topic real quick today is just over self-care. A lot of the topics that I'm going to discuss you guys have heard or you will be getting kind of throughout the rest of the day. But the main question I just wanted to ask everybody in here about self-care is, what exactly is self-care? This is the main thing that we tend to talk to you guys about as patients in the clinic. And what we believe self-care tends to be is where you guys, being the patients, are taking active enrollment in the care of yourself, not just passive agreeing as the providers, Dr. Bhimaraj or Dr. Trachtenberg would say, but really knowing and understanding your disease, your process, the type of heart failure, including the specific medications that are prescribed. Secondly, as far as self-care goes, just to make sure that you guys do, in fact, check your symptoms on a daily basis, that you guys are in control of yourself day in and day out. Not just checking your blood pressure and weight when you're going to come see us in clinic, right? We want to see what the whole trend has been from whether that's in the hospital to outpatient or just throughout routinely. So if patients do tend to tip, we are able to kind of see how and where you guys go from there. Really understanding your diet. You hear the same thing all the time. We always harp on what is appropriate diet, low salt, AHA, make sure you don't eat anything tasty, right? That's the main thing we tend to say. I know there's a lot of topic about diet and stuff in here, but that's one of the takeaways I want to really try to emphasize as far as self-care goes, making sure that everybody walks away from today understanding what exactly is a low salt diet. How can I follow this diet knowing that if I do follow this correct diet, it's going to help me in the long run? It's one of the last things. And lastly, the last point of self-care is, if you guys do take active participation in your role as patients with heart failure, you can truly lead a very productive life, both at work, both at home. Really empower yourself with the tools that you need to live day in and day out, knowing that if you ever come up to any of these barriers that have been suggested, you guys have the information that's needed to help drive the care of your own care. Thank you.